Welcome. This is Preston R. Harris. This is the Mastermind Expo. We've already had two great presentations, and now you're about to get a third. I got Mr. James McMorris coming to the stage today, and he's going to be sharing with you about what you can do to save our seniors. He's got some great innovative programs for people age 65 and up. So if you have parents that are turning 65, if you know somebody who's 65, these are great programs for them. So I'm going to bring Mr. James to the stage real quick.
Hello,
Mr.
family.
James, how
How
you
are you?
doing, sir?
Yes, sir, Brother Preston. How are you?
I'm fantastic, getting better every second. So what I'm going to do is I'm going to turn it over to you. I want you to just introduce yourself, explain a little bit about who you are, what you do at First Priority Insurance, and then give us that great information that you have for our seniors. We appreciate you, sir. And whenever you're ready for the presentation, just say presentation, and I'll have that presentation come right next to you. So I appreciate you, sir. Everybody, ladies and gentlemen, Mr. James McMorris.
Thank you, Brother Preston. I appreciate the opportunity to speak to this audience here that's allowed me to take an opportunity to share my experience, also my knowledge in this field of study, such as senior care. Of course, I have over 30 years experience in this particular lane of knowledge. I've been around for a while. I have an agency called First Priority Insurance Agency. We're located right here in the Great Riverdale, Georgia area. And of course, we've been here in this business helping seniors doing both season open enrollment and also AEP, which is annual enrollment period. So we're happy to discuss this information that we're sharing with you, family. It's just basically our goal right now is to help seniors make the right choice in choosing the right care for their health. We do believe that quality and affordable health care is very important to our seniors and also our under 65 class, of course, during this period of open enrollment. So let's get started, Preston. Go ahead, we can start from here. Okay, the first thing first, we'll talk about smart health and wealth and our guide to insurance, which we'll start out with remote care, of course, and then we're gonna move into estate planning. We're gonna start out with health, of course, for the seniors, remote care, and then estate planning. Welcome, family. We're gonna navigate you through the whole process. And next slide. Next slide. Next slide. Got a little technical difficulty. Hang on just 1 minute. Next slide.
Okay, James, could you
Let's go to the next slide, please.
so when you're talking about health and wellness for seniors and stuff like that, why are you focused on seniors?
Well, reason why because that's one of our most growth community that we have here in our area. We got the population is constantly growing. Of course, myself, I am a senior as well, and I've got taken advantage of all the benefits that most seniors have. Most of my seniors that approaching age 65 definitely can't wait to get that moment of care because, of course, you get the best care I think in that the system allowed to have because these seniors are very important in far as maintaining uh, great health and making sure they're well taken care of. So we take that very seriously, and that's a very big challenge for us, and it's very important. Now let's understand the basics of health. Of course, there's four things that we have to make sure we understand when it comes down to seniors. We want to provide a good network. A good network provider care is very important. We want to make sure we put our seniors in line with the current doctor that they choose and make sure it's a good fit. The worst thing we do is go to the doctor's office and he say, well, you know what, um, we don't take that plan. So now you have to go back and change your plan, and that could take could take a little time to get that in place. But we want to make sure first thing first is that we have our networks in plan because there are two different types of programs we have. We have HMO and PPO. Of course, with the HMO, it's very important that you stay in network. So, and with the PPO, it's a preferred providers organization network. Of course, even though you can go out of network, you do have expanded network services in that particular area. However, the copay might be a little higher, but you do have access to a little bit more extensive network. Prescription coverage is very important. We want to make sure that's done properly, because without the right prescription inside your provider network, that could be an issue as well. Because imagine going to the pharmacist physician office and order your medication, find out that medication is not listed on the formulary. Of course, you would have to get special request from your doctor to add that on, from the insurance carrier. I'm sorry, to list that as one of the medications. However, they'll probably, in most cases, they'll probably bring you down to the lowest level of medication and try to move you up to the next level. So there's a process for that. Premiums and deductibles. These things are very important. Of course, when it comes down to deductibles, of course, out-of-pocket costs. In most cases, you do have a co-payment and a car sharing involved. We have to make sure the cost sharing is very much important, because the lowest cost share, of course, is based on the type of plan you purchase. So the cost sharing is very important, because it could be a $30 copay for primary doctor visits, could be a $50 copay for specialists. But these out-of-pocket expenses, of course, they are pretty much a part of your maximum out-of-pocket as well. So every time you make a co-payment, of course, um, and also if you have to go to the hospital for the amount of care you receive, that will be subtracted from your out-of-pocket max. It could be, in most cases, I think this year it's like, I think it's $2,600 for out-of-pocket max for most carriers. We made some changes in that area, but that's important that we get a little more detail into that as well. And we also talk about the liability of these type of things per year. They are limited, and some companies have a higher out-of-pocket max, and some companies don't have, any out-of-pocket max. It depends on whether or not you qualify for Medicaid or one of our dual plans. That could make a difference as well. So these are things that you have to be conscious of based on the type of plan you have. If you're a Medicare and Medicaid, chances are you won't have to pay any out-of-pocket max, and your prescription drugs also have a zero copay as well. Your provider network, of course, you want to definitely make sure your doctor do that particular network. If you do have Medicare and Medicaid as a to pay that 20% that the hospital don't pay for, that your doctor is going to pay for. The out-of-pocket max, we did talk about that already. So go ahead and move to the next slide. Now, current issues facing seniors. Very important. These are very things that face our seniors today. And of course, the financial strain of that out-of-pocket medical expense, or either higher prescription drug costs, can be a major burden on most of our seniors, because of the fact that they chose maybe the wrong plan, or they might, in most cases, in a case like that, we want to make sure that these seniors could possibly qualify for prescription assistance towards their prescriptions, because there's certain levels of prescription drugs that you can actually purchase based on your level of income, and we would actually qualify you for that, and that's based on your income. So we want those strains to be eliminated by providing you with the right coverage under the right plan. Accessibility, of course, most of our seniors, they like knowledge of plans based on whatever area they live in. Um, Mobility barriers, ensuring the care. We have access to, in most of our plans, on our Medicare Advantage plans, of course, that's the additional coverage that you don't get through original Medicare. We also provide you with transportation. Of course, we require that you at least calls at least 3 days prior to your appointment to give you accessibility, and also ability to make it to your appointments on time, and have somebody to pick you up and take you back home as well. Not only just your appointments, but if you have to go get your medicine, we also provide benefits. No, some of our carriers, I'm not going to name any carriers at all at this time, but what I like to do is share that information with you once we decide to, on a sidebar, to sit down and talk about the value proposition of having access to all these additional benefits that have you do accessibility to your doctors, and also to the hospitalization or any medical prescription drugs that you have to pick up. Of course, health disparities. We know in our community we do have a lot of health disparities, and because we did a conference a little while back with Magic Johnson in reference to health disparities in the Black community. We do have that, and I always tell my seniors, don't you deserve better? And they do. They deserve a lot better. So here's what we do on that piece here is to basically make sure they go see the doctors on time. Of course, we do have another program in place as well to help them with that as well. So that's very important to make sure we have constant checkups and making sure that's all taken care of. Next slide. Solutions. All our comprehensive solutions, there are separate solutions. There are several solutions to making sure you have quality and affordable health care. One solution is our Medicare Advantage plan. I might have spoke with that a little earlier in the slide, but let's talk a little bit about that. That's this plan here been put in place. I think it started back in 2005 when Medicare was very hard to provide the benefits that the seniors are required to have. So Congress put in place the Advantage Plan. It gives you extra benefits in addition to what you currently have. Now, you don't lose your Medicare. In order to get this Advantage program, of course, you have to have Part A and Part B to be enrolled in this plan. Now, supplemental benefits, of course, Medicare is an 80-20 relationship. On the supplemental piece, original Medicare will pay that 80%. The supplemental will pay the 20%, depends on what plan you receive. It goes in alphabetical order. It could be G, the plan F, or the plan A, B. Those plans are in our supplemental plans. However, on the Medicare Advantage piece, going just back it up for just let me just back up for a minute. On that piece here, that's called Medicare Part C, and that's important on the Advantage program. Long-term care insurance. That's important as well. We know that long-term care can happen in any situation. You don't have to be a senior to acquire long-term care. Although most of our seniors do fit into that category once they receive some type of chronic or critical illness, such as Alzheimer's or something that affect where they can't really take care of themselves, or they can't use the five normal situations such as using the toilet, getting up and turning yourself over. So we have someone there to take care of you on a long-term care piece. Of course, it's good to get that early before you get older. The younger you are, the less it will be. So get that in place if you're not too sure about, if you're not too sure about who's going to take care of you when you get to be old. Of course, we talk about prescription drugs, all these solutions. That's very important to lower your medication costs. In order to do that, you have to qualify. Um, on our special election period, we could qualify you for a reduction in your medication based on your income. Next slide. Okay, strategies for saving our seniors. These are some of the strategies we put in place. Education is very important. We have to be educated on how and get with the right agent to give you the right information. Okay, your family's going to be there, of course. It can help you make these decisions. However, you need a licensed and certified agent to sit down and have a conversation with you and what would be the best plan for you based on your situation and circumstances. Of course, we have an advocacy group that will actually push to benefit our seniors and their needs of what they need and what they don't need. These policy changes takes effect once a year. Insurance companies get together and they also look at what is working and what is not working, so they make decisions on what plans they're going to put in place for the following year. Preventive care, very important. We encourage all of our seniors to screen themselves, make sure that their health style is correct, making sure they're eating the right food, making sure they're managing their chronic conditions, such as making sure that they have the proper exercise program, making sure they go to the gym. Of course, in our advantage plan, the gym membership is also included in that. Of course, and making sure you take care of your feet. If you have diabetes, of course, prevent all this stuff from happening where things want to get worse than what it really is. Next slide. Success stories. Let's talk about success stories. I'm going to be very, very frank with you about this one here. This is out here is very important. We want to make sure that you understand how successful this program has been over the amount of years I've been in this business. I've seen seniors living longer than normal. Of course, everybody say, well, it's all about the medication, right? It's not about the medication. The medication is one thing, but healthy lifestyle is very important. What you eat and how you take care of yourself. Take for instance this particular here. You want to reduce all your stress that you have to improve your health because stress do cause a lot of pain in your body. So we want to definitely get done with that. So let's take for instance Miss Johnson. She's 72 years old. And of course, to manage her diabetes, she has what they call the Medicare Advantage program. And with that being said, is that to manage that diabetes, we have an exercise, a physical fitness program that allow you to have access to all the major gyms, such as LA Fitness and more. So you can go really and take advantage of all the amenities that they offer for our seniors. I expect our seniors to go out and have fun, enjoy this lovely lifestyle of senior. And me being 67, yes, I'm enjoying my time. Of course, I put my work in, so I deserve a little time off as a senior to do things to take care of myself now. Now, case study A, which is Mr. Ramirez, 80 years old, Mr. Ramirez, and of course, he has a Medigap program that covers hospital costs. The reason why he chose this plan because Mr. Ramirez is very, very cautious about out-of-pocket costs. So he figured he'd just pay his payment every month consistently. It could be $180 a month. It could be $200 a month. Depends on the situation. But he also put a Medicare supplemental plan in place to take care of that 20%. So when he goes to the doctor or goes to the hospital, of course, he pays $0. Because why? Because he's making monthly payments towards his Medicare supplemental plan in addition to his Medicare Advantage plan, Part A and Part B. That pays 100%, 80% for Medicare, and 20% for his supplemental plan, based on the plan that he chooses. And next slide. Okay. Well, let's talk about me, who I am, of course. With the years of experience in this insurance planning business, of course, we've been very well taken care of, based on the amount of people we have taken care of. We saved a lot of folks along the way. We helped a lot of folks along the way make the right decisions. Of course, we've insured over, gosh, I can say over 1,000, 2,000 members in this benefit program. Of course, you have my number. That's 449144860. You can contact me anytime. I'm always available. My name is James McMorris, the First Party Insurance Agency. Of course, you have my email address. Please email if you have any questions or if you need answers in reference to how this plan works. Thank you very much.
All right, Mr. James, thank you very much, sir. Now, you said there was another program that you thought people should be aware of for our seniors. Can you explain that just a little bit for us, please?
Well, next up we have one of our very experienced professionals, Mr. Clyde Richardson. He's one of our top brand agents. He's marketing this program called Remote Care today. And our Remote Care Management Program is a very strategic program that we put in place to make sure our seniors get the right care and get access to quality and affordable care as well. So, Mr. Clyde Richardson, are you there?
Yes, I am, Mr. McMorris. How are you doing today?
Very well, thank you. Good to see you, man. You looking sharp over there, brother.
Well, thank you. Thank you. Very good presentation, summary as to how we can help our seniors. And that is something that either we are a senior, know a senior, or headed toward becoming a senior. So it really applies to everybody. Thank you for that coverage and thank you for that information. Very good information. What we're going to share with you next is remote care management. Now, we all experienced that pandemic, did we not? And we recognize that Medicare, which many on this Zoom are on, uh, has used Medicare, on Medicare, or knows someone that's on Medicare. And Medicare has been going more remote. In other words, well, we've seen a lot of things go more remote and more virtual because they found out that it's a lot more effective. It can cover a lot more people and it can be a lot more personal. And so Medicare is really with a program called Remote Care that's helping us in situations that can improve our quality of health and get the personal service that we deserve. Also, we're finding out that Medicare has a lot of products, a lot of services, and a lot of medical equipment that most people don't even realize and aren't taking advantage of. And so, remote care is what we're going to share today and how we can take advantage of the things that Medicare has in store for us. So let me ask a question. How many of us like going to the doctor's office and the doctor's visit? No, I'm sure not too many. What about how many like sitting in a waiting room with sick people? And no, not too many there. Well, what if we could not have to go to the doctor's office, get better care, and actually be in a position to decrease hospital visits, decrease office visits, and decrease the time, the energy, and the expense all associated with that. And as mentioned, have better care. That's what we're going to talk about. We're going to go to the next slide, please. What we're able to do is we have three major things that we have with remote care today. And one is the remote patient care that we just summarized. But also we have what's called Sarah Skills. Sarah Skills is absolutely amazing. You're going to love what you hear about that. And then we have the remote rehabilitation program. So we're going to kind of break down each one. We're going to spend most of our time on the Sarah Skills because that's just exceptional. But let's start with remote patient care. So let's go to the next slide, please. Okay, so what we have is a way that you can go to your doctor. Everybody has a doctor, most of us, all right? And we can share with them how they can actually provide better care for their patients, bring more money to their practice, and you can share in that money that they're bringing to the practice. So how does that work? Okay, well, let's just say I go to Dr. Jones. Okay, what I want to do is I want to show him a 3-minute video, very powerful 3-minute video. This video covers how we can help be an extension of his practice to be able to reach more patients. Okay, go to the next slide for me, please. Okay, and let's see, that's not the one. Okay, yeah, so what it is what we're able to do is we're able to connect the doctor with this agency. The agency is called Remote Care Today. This agency has been around for years, but they have just now started to use remote services more frequently. And this agency is going to call the patients for the doctor every month to check up on them. So think about this. Okay, now this agency is an extension of the doctor's practice. Remote care is a program that's helping fulfill a mandate that Medicare has. Medicare's mandate is they sent a 18-page report to every doctor in the country asking them to check on their patients more frequently. See, most seniors, most patients, period, don't go to the doctor until they're really, really sick. And Medicare is all about preventive, trying to create a program where preventive measures is helping to take care of these patients and not have them come in a critical situation. So now the doctor watches the 3-minute video. You schedule a call with the doctor, with the agency. The agency explains to the doctor that they're going to be calling the patients of the doctor and checking up on them every single month. Now, doctors have 300, 400, 500 patients. So obviously they can't get to them all, but this agency will be doing that. The agency is staffed with RNs. Everything is qualified and approved by Medicare. And now the agency is calling out, Miss Jones, how are you today? Are you doing okay? Good. Do you need an appointment or anything? You're doing fine? Okay, great. We'll call you next month and just check on you. Now, Ms. Jones is feeling great because a lot of problems with chronic care is what? Stress, uncertainty, anxiety, so much that's going on when you're dealing with pains and ailments and things like that. So to have this monthly call where everything's checked on is really great for the patient. Okay, the next call. Mr. Smith, how are you? You doing good? Are you taking your medications? No, they're making you sick. Okay, all right. Do you want us to set an appointment for you? Okay, we can do that. Okay, great. All right, well, it's all set. Mr. Thomas, how are you? Are you doing okay? You're not? Okay, well, do you need us to set an appointment for you? Oh, you have one coming up in January? Are you good with that? Okay, great. Say these calls, checking on the patients, they're doing so much in regards to helping the patient with their health. Okay, now at the same time, by partnering up with the agency so that the agency can make these calls for the doctor is now fulfilling a mandate that Medicare is asking the doctors to do. So when these calls are made, the data is sent to the doctor sends it to the Medicare, and Medicare is now paying the doctor for these calls being done. Even though the doctor is not using any of their time, any of their staff, they're using the approved agency to do it. So the doctor is now bringing $100,000, $150,000, $200,000 or more a month into their practice annually without having to use their time and their staff. And the patient is getting better care. It's totally a win-win situation. How powerful is that? Well, it's powerful for you because you introduced the doctor to this program. So you will start earning on every call, every month to every patient for the rest of your life. Yes, when those calls are made every single month, you will get a residual income portion of those calls. And just like that, just for referring that doctor, you could potentially start making an extra $2, $3, $5,000 a month in residual income that can come in for the rest of your life. Now, once you set this up, it's maintenance free. You will be earning that income. Now, as seniors pass away, there's more seniors coming in. In fact, every day, 12,000 people turn age 65. So that income will continue to come month after month, year after year, as some are replacing the ones that do pass. How powerful is that? That's very, very powerful. You've just helped in so many ways, and you've put yourself in a position to earn income by helping. Now, let's back up to the slide that we saw previous to this one, please. We're going to talk about the next leg of that stool that we talked about, and that is called Sarah Skills. Okay, so this is a different program under the same umbrella. Okay, now just to make sure we understand, we just talked about remote care. We just talked about how doctors can use this agency to call their patients and to get them cared for every single month without the doctor getting involved and the doctor making it additional income and you sharing in that income. If you look to the far right, you'll see a program that we also have called Sarah Skills. This is a program that is really unique. You do not need a doctor. It can be provided by pharmacists, chiropractors, dentists, senior home care centers, because all it is signing up for a program that is paid for by Medicare Part B. And what it is an app is sent to the senior on their phone where they're able to daily be able to follow a exercise program that's helping them with their health, their memory, their balance, their cognition, all the things that we feel is, well, we're just getting older and we have to deal with. No, they're finding out that a lot of these issues we do not have to happen at the age that it's happening. Because by keeping the brain active, by keeping our these short little exercises that the Sarah Skills has the clients do, they're creating their balance, they're exercising their mind, their brain, their health, and we're seeing reversals of so many things. We're seeing individuals who couldn't climb stairs now climbing stairs. We saw individuals who are losing their memory, getting their memory back. We've seen individuals that are having trouble with their balance now also being able to keep their balance. We're seeing these things actually not only being corrected, but in some cases being reversed because of this program. It's an in-home program that individuals are able to do with a personal coach, and it's just a few minutes a day. It's every other day, just a few minutes a day. They're on the app, on the phone. doing these exercises, and it's amazing how the brain, the mind, the function, everything with the system works in harmony. And we're having so many results and so many testimonies. It's amazing what we're experiencing with this. So who can get it? Anyone on Medicare. How much does it cost? There's no cost. Do you need a doctor referral? No. Do you need an insurance license to share this with? No. Do you need any type of referral? No. It's anyone, everybody that is on Medicare, that has Medicare Part B, just sign up for it and it's paid for. It's totally covered. This is something that Medicare wants us to do because it's going to help prevent it. It's going to help us be able to continue to have a better health lifestyle. Go to the next slide, please. Okay, and the next one after that. Okay, so those are two of the programs we're focused on. The third one on that stool is a way to have an in-home service that's also on an app on your phone where you're able to now, when you leave, if you have a hospital visit, you're able to leave the hospital and you're not likely to be able to have to come back because they're doing exercises and they're doing things with you that helps you benefit from your hospital stay and be able to return your health back without having to be readmitted for something that could be taken care of at home. So those are the three-legged stool that we mentioned, and we want to just share that program with everyone because it's available and people don't even know it. In fact, when we get on this remote care program, we're also able to help seniors with their different products. Maybe it's something dealing with their breathing. Maybe it's something dealing with a walker. Maybe it's something dealing with a wheelchair. A lot of these things are paid for by Medicare, and we make you aware of them and we help you get them. And so what we're all about is remotely helping individuals stay at home, get better health, have a better quality of life. It's saving people on expenses. It's allowing them to get what they have available to them. And what it's able to do is it's able to help them have a better quality lifestyle. So there's my contact information there. I work along with James McMorris and Kimberly McMorris and through the First Priority Insurance Agency. And with this, we're able to help individuals get the help they need, not only with the insurance coverage they need, but better health, better care, more productive lifestyle, and the ability to also earn income by helping others do the same.
Hey, Clyde, this is awesome. Thank you so much for joining us on our Mastermind Expo, Freedom Friday. This is an amazing program for seniors. I really love the SARE skills. I think that can definitely help a lot of seniors. Where people can reach out to us and they can find out how to get more information. We hope James. We know that James thought this was very important to when we're talking about saving our seniors to give them this information. So, Clyde, we hope you join our mastermind family sometime too, so we can continue to make an impact. But thank you so much for sharing that remote care opportunity and also the different programs that are available for seniors with us today.
You're welcome. My pleasure.
All right. All right. So James has another half. And we're going to talk, I'm going to bring in Miss Kimberly McMorris. Kimberly, how are you?
Amazing, Mr. Harris. Thank you for all that you continue to do.
All right. All right. So I'm going to change the name on here. I know you have something to share with us. So I'm going to get out of here. And we love to hear what you have to share with us about estate planning for seniors. So thank you so much, Miss Kimberly McMorris, and we look forward to hearing from you.
Thank you very, very much. Well, family, well, first off, it is just absolutely an honor and a pleasure for you to be here today because you could have been any place else, but you chose to take time out on a Friday afternoon to be able to gain some valuable information. So I'm just simply going to dive right in. And in estate planning is actually near and dear to my heart. And the reason why I say it's near and dear to my heart, because it used to be a time, right, whenever we would pass down businesses from generation to generation. how we will pass down houses from generation to generation. So we just simply have to get back to that because we all have something to leave behind. And so it really is just simply deciding not only what's important to you, but what it is that you think will be important to your loved ones. And so there are several different components to estate planning. Of course, right, we want to discuss asset protection. And basically, that's just simply making sure that whatever it is that you have, to make sure that it's actually distributed evenly and properly, excuse me, to your loved ones. And then if you take the time to actually do estate planning in advance, the most important thing really truly is, to write that last love letter to your family, so that this way, so that you can have family harmony. Because we want to be able to, know that whenever we do leave this earth, because the one thing that I tell individuals that, we're all born one day and that unfortunately we're all going to die one day. And so, therefore, whenever that time does come, we just simply want to make sure that whatever your wishes are, that they are expressed properly. And then, of course, we also want to make sure that we can, avoid, tax burdens and things of that nature. And then also, I'm going to touch on a little bit about, powers of attorney, because you need to not only have a financial power of attorney, you need to have a healthcare power of attorney also. And so I just simply tell individuals that the one thing, and in fact, right, where Mr. Clyde Richardson, he touched on this earlier whenever he was talking about COVID. There were so many individuals, unfortunately, to where they were incapacitated and they couldn't speak for themselves. And so the question now becomes is that in the event that if you find yourself in a situation where you cannot speak for yourself, who is it that you deem that you trust who will have the ability to speak for you, not only, in death, but also to speak for you while you're living. And so, next slide, please. Mr. McMorris, next slide, please. Thank you very much. And so now, whenever it comes to the importance of estate planning, where I just simply say that there are five pillars. And then, of course, right, the first pillar is peace of mind, because, just simply knowing that you have everything in place, it will absolutely give you personally peace of mind. It's like whenever I think about, thank goodness both of my parents are living, but I will speak to Mr. McMorris's mother, because whenever she passed away, she had already designated that even though she had seven children, to where, excuse me, the youngest son, he actually ended up getting the land. And then the oldest daughter, she ended up leaving her the house. And so, whenever she made that decision, I can recall my husband saying that he questioned his mother because, of course, she had expressed her wishes in advance. And she was just like, well, of the other children, they already had homes. And so, therefore, she made a conscious decision just simply to make sure that the other two also had a place. And so that this way, so that her legacy could continue on. And then also, whenever we think about asset protection, there are some people where whenever I'm talking to them about doing a will, they say, oh, well, I don't have anything to leave an asset. Everything is an asset. If you have a car, that is an asset. Who do you want to leave that car to? It could be your favorite watch. It could be, that fur coat. It could be a favorite dress. It doesn't make a difference, but we all have some type of asset that we can leave behind. And then also, whenever we're thinking about asset protection, where I kind of touched on this earlier about, of course, my husband and I, we are business owners. And so, therefore, you need to not just simply think about protecting your personal assets, but you also have to think about protecting your business assets as well. Because if you worked hard, if you built a legacy, you absolutely want to make sure that unfortunately, whenever you pass away, that legacy does not die with you. And then, whenever it comes to healthcare wishes, have you thought about what it is that you want your healthcare wishes to be? God forbid, if you should find yourself in a situation where you can't speak for yourself, have you designated who it is? It's like, do you want someone to pull the plug? Do you want to be put on life support? Do you want to receive blood? Just what is it that you deem whenever it comes to what are your wishes, whenever it comes to your healthcare wishes, not only while you're living, but also in death. And so, and then whenever it comes to legacy, excuse me, preservation, to where we all have a legacy to leave behind. whenever I think about, the Rockefellers, to where the Rockefellers, they made sure that they left a legacy. And so, not only for themselves, not only for their children, but for their children and their children's children. And so those are just simply some of the things that we have to think about, is that, to where I've heard this being said, is that, can you leave, us with something other than some debt? There was a young man that I was speaking with not too long ago. I was with my husband at an event for men because he's a member of the Omega Psi Phi fraternity. And whenever he told me his name, he had a very distinct name. And I cannot think of what his name was, but I was like, oh, wow, like that's a really an amazing name. And he was just like, yeah, my dad gave it to me. And so he was saying about how his dad was a member of the Omega Psi Phi fraternity as well, but he had passed away. And I was just like, oh, well, when now your dad, well, at least he did pass down a legacy. And he was just like, well, yeah, well, the only thing that he did pass down was for me to join this fraternity, because whenever he died, he left me with nothing. And it was like he was so happy talking about his dad and his dad being a member of the Omega Psi Phi fraternity. But his disposition immediately changed because his dad left him with nothing. And so, whenever you think about legacy preservation, these are just simply some of the things that we have to think about. And then also, whenever it comes to tax minimization, because I tell individuals, whenever it comes to, estate planning, now I can speak for us here in Georgia that if you do not have a will in place, unfortunately, the state is going to decide who gets what. And then not only that, to where estate taxes is actually 38%. So if you can imagine, to where that, the type of peril that that might leave your family in, just simply by not taking these proactive steps to make sure that you actually put your estate in place. Next slide, please. And so now, as we move forward to, the next steps of estate planning, most people just simply just think about a will, but it's not just simply about a will, even though we do want you to have a will, a living will, a health care, and a financial power of attorney. But we want you also to think about doing a legacy will. And so I had actually never heard of a legacy will, actually probably until about, I said maybe like about 10 years ago. And in fact, when my mother was here visiting, I actually asked her to do a legacy will. She's like, I've already done a will. And I was like, Mom, like, I understand the fact that you did a will, right? But also I want you to do a legacy will. And then, right, whenever I showed her what a legacy will is, it basically, right, what this does is that this gives you the opportunity to pass down your experiences, your values, and also advice and life lessons, to those you love. And then not only that, what is it, that you want done at your funeral, right? It's like, what song do you want sung? What Bible verse do you want read? What type, excuse me, it's like, what flower do you want? And then not only that, even with how, whenever I say passing down experiences and valuable lessons, things as simple as, my favorite subject in school was math, because, to where with my grandson right now, he's actually going to school for finance. And so whenever, obviously with him having a love for math, and then my mother having a love for math, that is just going to be an immediate connection for him. Something just that simple of, oh, this is where I got that from. And so it's just simply something that we want you to think about, because, to where, of course, right, it says here a legacy will, because of what you do today was once tomorrow. And so it's just some things to think about. And then, of course, right, whenever it comes to estate planning, those of you who do have a life insurance, make sure that you update your beneficiary form. And then, not only that, right, make sure that you have, the individual's names on your bank accounts, just in case of something should, indeed happen. Because even with, of course, obviously my husband and I, we own an insurance agency. We actually had a client, and he had $100,000 of life insurance. And even though he had been divorced for over 15 years and had a new wife for 10 years, unfortunately, whenever it came to the life insurance, he did not think to update his wife as the next, excuse me, as his new beneficiary. And that $100,000 ended up going to his first wife instead of to his second wife that he loved. So these are just simply some things to think about whenever it comes to actually designating your beneficiary forms. And so next we're going to go to, excuse me. Yes, sir. That's like, click on it. Fantastic. All right. So now strategies to minimize estate taxes. So now you can actually gift, excuse me, rather if it's um, where if you do have, a decent estate, and if you want to begin to minimize, your tax strategies, we can actually help you with that as well. So you can definitely schedule, a call with us, and then we can sit down and then take you through your own personal plan as far as whenever it comes to gifting, because you might want to get an additional, $100,000 church. I'm sorry, an additional $100,000 of life insurance just simply to leave, to your church, or you might want to leave $10,000 to your church. Because I tell individuals that just because you pass away, should your tithes and offerings still, should they die with you? So therefore, we could absolutely show you how you can put some things in place. And then, of course, right, to where even as far as with establishing a trust, to where, a trust is a way for you to be able to protect your assets. And so you can sit down with someone and then decide on the different types of trust, because you could get a personal trust where you put your house, your car, things of that nature, life insurance, annuities, all in just one trust. Or by chance, if you own a business, you might want to set your business up in a trust. And so that this way you can make sure that whatever it is that you deem necessary is protected. And of course, right, I mentioned earlier about charitable donations, to where we've actually had some of the members of our church actually leave, leave a portion of their life insurance. Or, of course, you heard me mention about my husband and him being a member of the Omega Psi Phi fraternity, where you might just simply want to get a specific policy where you can make a charitable donation just simply to make sure that, yet again, that your legacy is preserved. And then, of course, right, whenever it comes to life insurance is extremely important. Life insurance is actually, the cornerstone of estate planning. And then, right, whenever we think about life insurance, most people say, oh yeah, to where I just simply want to have enough life insurance, to bury me. Well, that's just simply because at one point that's all the life insurance that we could get was just enough for someone to bury us. But now you need to think about, especially if you're the head of the household, not just having enough life insurance to bury you, not just having $100,000 of life insurance, but you really truly need to think about having 7 times the amount of whatever your current salary is. So therefore, if you make $100,000 a year, you should at a minimum have $700,000 of life insurance, just simply to make sure that you do not leave your family in financial peril. And then you also may want to consider, like, do you want your kids to go to college? Do you, do you have a mortgage to pay off? Just, you know, whenever it comes to life insurance, make sure that you sit down with someone that you trust and that you respect to make sure that they actually help you with your life insurance plan. Next slide, please. The one before that, please. Fantastic. All right. And so now, whenever it comes to the benefits of estate planning, of course, as I've already stated, is absolutely, for financial security, not just simply for yourself, but also for the ones, that you leave behind. And then these are decisions that actually should be made as a family. Now, true enough, your decision is your decision, but make sure, the same way that I mentioned about how with my husband, that although she had 7 kids, she sat down and called a family meeting just simply to say, these are my wishes, and then this is what I'm going to do, so that there will be no squabbling at the end. And then, of course, whenever it comes to family protection, we want to make sure that your family is protected so that they have peace of mind. And then, lastly, of course, we want to discuss legacy building, because no matter what it is, we want to make sure that whatever it is that you value, that is passed down from generation to generation. Next slide, please, sir. All right. And then now, whenever it comes to estate planning, most people think that estate planning is difficult. No, it's not. You can literally, do your will, your living will, your health care, and financial power of attorney for as little as $30 a month. And so we encourage you to do it. And then not only that, you should also update and review your will once a year. It and then where I tell individuals, right, if you have a major life event, if you get married, update your will. You buy a house, update your will. You have a new child, update your will. You have a new grandchild, update your will. You buy a car, update your will. So just simply think about those major events that would prompt you to update your will. And of course, as I've already stated, now here, right, this says 30% because that is what the nationwide average is whenever it comes to estate planning. But here in Georgia, it's 38%. So whatever your estate is, if you do not have a will in place, unfortunately, 38% of that is going to go to the state of Georgia. And then now I'm gonna touch on this. I purposefully saved this for last, is because it's a little personal to me. But if you have children, right, who are under the age of 18, I implore you to put a will in place because you might say, oh, well, I want my child to go to my sister, or oh, I want my child to go with my grandmother, right? But if you don't have that in writing, you could end up in a probate situation where the courts would decide where your children go. And the reason why I said that that is a situation that's near and dear to my heart, because unfortunately, my favorite aunt, unfortunately, she was killed by her husband, and they had 4 children. And my mother, she wanted to get custody of, her 4 children. And so, but unfortunately, at the time, my mother was not married. And so, therefore, the court ended up having to have I'm sorry, my mother's brother, if he was newly married and he had 2 small children, and had to take on 4 additional children. Yes, true enough, he did it, but it's a big difference in doing something because you have to do it and doing something because you want to do it. And so I just simply want to make sure that if you put a will in place for no other reason but to protect your children, that we absolutely want you to start thinking about this because, again, as I stated previously, we are all born one day, and unfortunately, we're all going to die one day. And so, therefore, we just simply want to help you to protect what's most important to you. Next slide, please. All right. And of course, my name is Kimberly McMorris. Please do not hesitate to reach out to us if you have any questions at all about actually, very, very affordably, at least beginning the process of estate planning. Because I tell individuals, right, the very first thing that we want you to do is to put a will in place. And then if you have businesses, if you have houses, if you have cars, if you have other things that might need to be put in trust, at least let us start by doing what's most affordable and absolutely put that will in place. And thank you for your time. And Mr. Harris, sir, I am going to turn it back over to you, sir, and just thank you for all that you continue to do to uplift and to empower our community.
Hey, Kimberly, this was great. This was so much great information. Thank you for blessing us with that estate planning. I definitely learned a lot. I didn't know that 38% can be taken in probate if they go to probate court in the state of Georgia. So that was some great information. While I got you here, and I know James is close, can you tell us a little bit about your experience in the mastermind? This is the Mastermind Expo. I really appreciate you coming in and just giving us the time to share your knowledge. But why are you guys in the mastermind? Why is this something? You guys are married, you got first priority insurance. Why would you guys give your time to a business mastermind? What can you just explain that to me and just tell us a little bit about your experience?
Well, now there's a multitude of reasons. And so, even though, yes, true enough, right, we've owned a business for several years. So therefore, it's not like we really necessarily needed the business experience, but it really is all about, community and really truly being able to give back. Because whatever they say, reach one, teach one, someone took the time to actually to educate me and then to show me, excuse me, some different ways and some different paths in business. So I feel like it's my responsibility to be able to excuse me, to step back and then also to be able to do the same. And then just simply from a business perspective, I mean, it has been unreal how many clients actually reached out to us because they say that they're a part of the mastermind and that and Preston, whether it be from you specifically or either from someone in the mastermind group. And then knowing that we can share our knowledge and be helpful, to help you continue to uplift and empower our community. I mean, it's impactful. And so I am very, very grateful for you taking the time to do this and to bring us together in collective and safe spaces where we can learn and glean from one another.
Hey, thank you so much, Kim. That's
You're
awesome.
very, very welcome. You're
Appreciate
very
you.
welcome.
You're awesome. You and James
Yes,
are great. You guys do great business. Thanks for all the help that you do for our mastermind
wonderful.
members. You are right that we do get a lot of requests. People needing business insurance, car insurance, bonds, title bonds, health insurance, and we always just pass them right over to first priority insurance. And it's just great to be able to work with such amazing people. Thank you for bringing in Clyde today. Thanks for having him on.
Yes,
If we could get James real quick, because I
wonderful.
know we have quite a few women in the mastermind, but I want to get this from a man's perspective because we do need some more brothers in here. How does it like when you're connecting with other brothers that are working hard in the mastermind? What is that connection like? Because I know that's important to you. Brotherhood, that's something that's really important to you, Mr. James. So I appreciate you. But can you give us an idea of what that brotherhood's like, and encourage other men to come in and collaborate and join and partner with us?
Well, thank you very much. Thank you very much, Preston. I appreciate that. Yes. With that being said, the mastermind got have actually created a whole nother network of opportunities for our operation, our business. We met some of the top brand people that's in this industry that really believe in the idea of group economics, creating an ecosystem. I met pretty much every member of this organization. I actually support them as well, and I've actually spoke with them in conjunction of what we're trying to accomplish. We all remember Black Wall Street and how that was created amongst our individual business owners and create an economic ecosystem amongst ourselves. In this day and time, right now we moved into a whole nother world, a whole nother way of life. Until we understand the value of who we are and what we do as professionals, talking about the CMOS, the deep port, and talking about all the other major programs that we have tied into this mastermind experience. Um, I want to tell you, if you really want to really meet some really sharp people, for the ones who have not became a member of this whole scenario, I advise you to get involved with the mastermind so we can create a large degree of circle of professionals to add to our process so we can share our revenue amongst each other. Very important. And this is where we're going to go for the next 20 to 2025. This is where we're heading in that direction. So now's the time and the place to put your business on site to be promoted through the mastermind concept and the experience that you receive from that. Thank you very much.
Thank you, sir. Well, we appreciate you for dropping the knowledge and saving our seniors. I'm gonna drop a little knowledge on them. They don't know that you're a Coast Guard veteran. We appreciate your service. Kim is a veteran as well, and so we appreciate both of your services. James is always talking about. I was in the Coast Guard, so I had that search and rescue, and so he went out and searched and rescued some seniors today. So we appreciate you, sir. Just your contact information one more time for those people who need it, and then we'll wrap this thing up for us.
Yes, sir. You can reach me at my direct line be 404-914-4860. That's 404-914-4860. And that's James McMorris. Of course, my email is first priority insurance 54 at gmail.com. You can also go to our website at firstpriorityinsurance.info. That's firstpriorityinsurance.info. And you can reach us and we'll definitely be able to help you out. Whatever, any type of needs you might have, remember, just like Preston says, we are the business of searching and rescuing folks, and that's what we do. We search and rescue, get folks back in place. Thank you very much.
All right. Thank you so much. This has been Mr. James McMorris. Save our seniors. It's the Mastermind Expo. You know he's an Omega man in the building. So we'll see you a little bit later. We've got the Art of Winemaking at 7 p.m. Shout out to Crystal Floyd, and then we've got the CMOS Depot at 8 p.m. Those are the rest of our presentations today. And then if you want to come see Kim James, myself in person tomorrow. We'll be at the Russell Center at 2 p.m. in Atlanta, Georgia. We've got a great AI training. We've got Perfect Your Pitch. We've got Gift TV. We've got the CMOS Depot. We got so much going on. You got to come check us out. It's the Mastermind Expo. Thank you, Mr. James. We appreciate you. Thank you, Kim. Thank you, Clyde. And we'll tune back in. We'll see you this evening. Go ahead and be great. Let's go.
Yes, sir. Thank you.